one of the drivers for investigating estrogen as being a neuroprotective um, chemical or substance for the brain has been women who have a longer reproductive year, have more estrogen exposure in their life, and they have potentially a lower risk of Alzheimer's disease. And then also, as it relates to childbearing, it seems that studies will show us that women who have between 1 and 5 children appear to have a lower risk of dementia later in life. And again, a lot of that had been chalked up to these large swings in hormones or large elevations in female reproductive hormones that occur in pregnancy. But there have been recent studies looking at brain imaging in women before and after pregnancy. And we actually do see that the brain structure changes pre and post pregnancy. So, people always ask, is this mommy brain? What is mommy brain? And I think this is really cool because when we think of mommy brain, we think about, oh, I'm being so forgetful. I can't, do the things I used to do. But there really is a mommy brain. And this mommy brain is related to how the brain structure changes. And it's not necessarily a bad thing. It actually may be one of the reasons why women that have had children are at a lower risk. So what we can see is a loss of gray matter in specific regions of the brain, ones that are related to social cognition, which of course is an important aspect when we think about Alzheimer's disease. And these structural changes were followed up postpartum up to 2 years, and we still saw these same structural changes. What was interesting about this study is that it showed that women had a loss of gray matter, which is the cell bodies of the brain. It's where all the action happens. Um, and when we hear that, we think, well, that actually is a bad thing. We read studies and we see brain volume changes are negative. We don't want to see brain volume loss, but it's actually a really important reminder that sometimes when we see brain volume changes, it could actually represent new or tighter neuronal connections and reconfigurations of neuronal networks. So it could be an adaptive process that's happening. So important that we don't always interpret brain volume changes as problematic, and also just so interesting how pregnancy and what's happening during pregnancy is really changing the female brain structure in areas that seem to be impacted in Alzheimer's disease. Despite having an infant, which is impacting your sleep, your exercise, your diet, potentially your socialization, potentially how intellectually stimulated you are because you aren't working as much or doing your hobbies to the same level that you once were doing. It's important to remember that the studies that we have show us that women who have had between 1 and 5 children seem to be at a lower risk of Alzheimer's disease. Whether that relates specifically to these hormonal elevations that happen during pregnancy or structural brain changes that happen during pregnancy or the cognitive benefits that can happen during raising children, it's clear that even though you aren't doing all of those lifestyle things that you once were doing, there is some of that offset by the process of having children. Of course, we want you to be able to sleep and exercise and, do all the things that you once loved doing. It can be really, really challenging during this period. My advice is don't become overwhelmed. Don't feel guilty about not being able to sleep as much as you once were or to exercise for an hour. Do what you can when you can. Eventually, you'll get back there. It's more important to prioritize your social interactions and your family time during this amazing period of your life than it is for making sure that you're getting your 8 hours of sleep, which is just not practical for people who are in this period.
We hope you enjoyed this video. To access a free Mastering Brain Health course led by Dr. Richard Isaacson, visit ind.org/learn. And to directly contribute to IND's research efforts, visit ind.org/donate.